Good morning, everybody. Can I thank the more than 32,000 people that were tested in the last 24 hours, which takes into account Sunday. Obviously, that is a good number for a Sunday, but we're really keen to make sure we keep those testing numbers above 40,000 where possible. So I do encourage everybody to please make sure you come forward and get tested with the mildest of symptoms. If you've been at a venue of concern or you've received advice to go and get tested, please do so. It helps us make sure that we don't have those chains of community transmission in the community. Overnight, New South Wales recorded 18 cases of community transmission. 11 of those cases were people that were completely in isolation. 5 of those cases were people that were partially in isolation, and 2 people, unfortunately, were infectious in the community. Now, the lockdown is having its desired effect to date, no doubt about that, but it's still concerning that a number of cases are remaining infectious in the community for that period of time, and some cases have been received are quite historic, so that people have been exposed in the community for a number of days, and that's something we don't want to see. We don't want to see that. And can I also please give a call out to young people? We are noticing younger people coming through and testing positive, and we encourage you to please make sure once you do get that diagnosis, when you're speaking with health officials, you won't get in trouble. Just tell us what you've been up to, where you've been, to make sure that we really clamp down on those close contacts to keep everybody safe moving forward. I will also update the community to say that we've been having various discussions with health experts and others in the last few days, and that will continue throughout today and into the early evening. And I hope to be able to communicate to the community tomorrow on what next week looks like. So I hope to be able to provide some information tomorrow, but every minute we have, every last bit of advice we have supports us in being able to make those important decisions. The New South Wales Government's priority is always about keeping the community safe first and foremost, but also having a keen eye on opening up the economy as well, and it's that balanced approach we'll take into our decision making. But I do want to say this, New South Wales wants this to be the last lockdown until we get the majority of our citizens vaccinated. And the difference now to what occurred in the last year or so, since we had the one and only other lockdown, is the Delta strain. This strain is very different to what we've experienced, and if you look at other jurisdictions around the world, we can see that you can't afford to let this get away from you. So whilst we have the best contact tracers in the world, and I believe that the right settings at the right time for our population, we have to be mindful that what we're experiencing with this strain is something new during the pandemic. It's not something we've seen before, and that's why it requires a different type of response. We only intend for this lockdown to be the only lockdown we go through, and that will factor into our decision making as to whether it finishes on Friday or whether we continue for a period longer. But I do, again, hope to update the community tomorrow. Obviously, what will be foremost in our decision-making as a government and with my colleagues is the health advice, and also, of course, what we need to do between now and when the majority of our citizens are vaccinated. I'll now ask Dr Chant to provide her health update and then obviously take questions. Thank you.
So New South Wales recorded 18 locally acquired cases of COVID-19 to the 24 hours to 8 p.m. last night. 16 of the locally acquired cases are linked to a known case or cluster, and of these, 9 are household contacts of previously confirmed cases. 11 were in isolation for their entire infectious period. However, there were 5 in for part of their infectious period being 1 day, and 2 in the community for greater than 1 day infectious in the community. The source of 2 cases remains under investigation. We had no new cases were acquired overseas in the 24 hours. We have had 32,136 tests performed, and we appreciate that people came out for testing. We need to see those numbers sustained and increase. I'd like to see over 40,000 tests every day this week to give us the best assessment that we are not missing chains of transmission. The areas that I'd like to really focus on at the moment is our Fairfield and Bosley Park communities. I'd like to see incredibly high testing rates in those communities as we try to identify any unrecognised chains of transmission. My message is also about getting vaccinated. For those that have had their first dose of AZ and it's coming up time for your second dose of the AstraZeneca vaccine, make sure you have an appointment. Against the Delta strain, 2 doses of both Pfizer or AstraZeneca are very effective at preventing hospitalisation and death. So I would urge the community to respond now. Do not delay in getting your second dose if it is coming up and due. In relation to venues of concern, the Bosley Park Club Marconi at 133 Prairie Vale Road on Friday the 25th of June from 2 p.m. to 8:30 p.m. and Saturday the 26th of June from 10 a.m. to 6 p.m. So the advice has been updated for this venue. Anyone who attended the venue at the times I've just described is a close contact, must immediately get tested and isolate for 14 days regardless of the result, unless they've already been contacted by New South Wales Health. It is also essential that if you are a close contact, please keep your household inside until we've confirmed that you're negative. We want to get ahead of any chains of transmission that might have been established. In terms of the severity of the COVID, it is important to note that we've had currently have 26 COVID patients that have been admitted to hospital. Of these patients, 6 are in ICU, 2 whom are ventilated. The ages of those in ICU is 1 in their early 50s, 1 in their early 60s, 3 in their 70s and 1 in their 80s. This is a salient reminder about the impact that COVID can have on you and your loved ones. So please, as you move about the community, assume everyone has COVID, follow the public health advice, and please minimise your exposures to others, particularly in indoor settings. In relation to Summit Care, there's been one further case in a worker at the Summit Care Balcombe Hills. The person tested positive, but as you know, we go back to assess whether there could have been any exposures to anyone else at the facility. Pleasingly, there were no further resident exposures from that diagnosis, but there were a small number of additional staff contacts identified, and action has been taken to identify those staff and put those staff members into isolation. In relation to the Meriton Suites Waterloo and the party or event I described yesterday, can I just genuinely thank those young people who attended that party, that have cooperated with our contact tracers, that have given us the information, that have got the message out to their family and friends. And associated with that gathering, there's been 7 people who attended the gathering tested positive and 5 household contacts of these people who tested positive. There was clearly a lot of testing around the Meriton Suites Waterloo, and I thank everyone for their patience as we work through that information of those testing results and some retesting that occurred. There will be a meeting around midday to consider all those results, and it's likely that additional updated advice will be given in relation to the Meriton Suites. But at the moment, I'm not aware that we've had any evidence of transmission beyond that party group, but that will be a matter for those results coming in as we speak, and updated advice will be provided once we've had the opportunity of reviewing all of those results. So my key messages are that we need those testing rates high, particularly in Fairfield and Bosley Park. We also need people to continue to come out and get their vaccinations, particularly if you're due for your second dose. Don't delay. Having those 2 doses gives you and affords you a significant degree of protection from hospitalisation and death, so don't delay. Also, please continue to move about as if everyone you could come in contact with has COVID. That will actually help prevent any further chains of transmission. Also, we are putting up some historical venues. So what happens is, as we are working through and finding new chains, or people are recalling that they have been at different settings or the events, we are unearthing exposure venues that date back historically. So again, it may have been that you think you've only been in-house and you've checked the website a week ago, and because you haven't been moving about, I don't need to check it again. What I'm urging you to do is please refresh yourself, go to that website, look at the venues of concern, because there are a number of historical venues and some important public health advice in relation to those venues.
If we continue with the trend of no regional cases, no spread into the country, can they take off their masks? Can they have more than 5 to their home?
Oh, look, I don't want to predetermine any decisions we'll take in the next 24 hours. But to say, obviously, the health advice is based on the period of time we've been in lockdown, and I'm very pleased that regional New South Wales hasn't had any cases. We had a few close calls, but the communities have responded really well. And we'll base what next week looks like in the regions and in Greater Sydney on the health advice. So there are issues that we'll consider later today and early tomorrow morning, and I hope to be able to update the community tomorrow.
Is that very much linked to the overall lockdown decision?
Look, of course, the New South Wales Government appreciates the importance of restoring face-to-face teaching, and we're looking forward to looking at that issue. We appreciate the stresses that parents go through in particular with having to have students at school, at home rather. So we're considering all of that in our decision making, and again it will be based on the health advice. I don't want to preempt what that advice might be or what the New South Wales Government's response to that advice will be, but I understand more than anything what our community want is certainty. People want to know what life will look like beyond Friday midnight, and I'm keen to provide that certainty to people tomorrow so that people can make arrangements if they need to moving forward. But what I can say is based on the health advice, the New South Wales Government is very much not only thinking about when we come out of lockdown, but what coming out of lockdown looks like. And then in addition to that, what life looks like until the end of October when we have many more vaccines available. So they're all the considerations for us at this stage, and I'll be pleased to update the community tomorrow, because I know more than anyone how important it is for people to have time to plan, to think about what life looks like. But I don't want anybody jumping to any conclusions by what either I've said today or Dr Chant has said today. Please know that we'll be looking at the data and analysing the advice right until the last minute, to make sure that we provide the best advice to our citizens, which will obviously keep everybody safe, but also keep everybody working and active as well.
Premier, can you please give an explanation? Can you please?
Tomorrow.
I'm sorry?
What is it going to take between now and tomorrow for you to feel confident that we can, in fact, come out of lockdown? What's it going to take?
Well, as Dr Chant said yesterday, a day or 2 days doesn't mean a trend. So what the health experts look at are trends to see where the direction in which things are going. So we know definitely that lockdown has been successful in not exponentially increasing the rate of disease. So what is really scary about the Delta strain, if you look at other countries around the world, 2 cases become 20, become 100 or 200 very quickly. We managed to avoid that in New South Wales. So we feel we made the lockdown happen at the right time. Our health contact tracers are very much in control of what's happening, and we want to make sure that stays the case moving forward. So what we'll be looking at is obviously the health advice, and what the health experts look at are trends, where the direction is going and what the likely situation is going to be at Friday midnight, and what that means for our citizens beyond that time.
Premier, regardless of when the lockdown does finish, you've spoken a couple of times about how the Delta strain is new and it's different. We're going to have to live differently with this strain of the virus before we're all vaccinated. Can you please expand or explain what life will look like when lockdown ends? Do you envisage that we'll be living under tighter restrictions than we were living in with the previous strains of the virus until we're vaccinated?
Well, that's an option, and that will depend on the health advice we receive. And I anticipate that when we do come out of the lockdown, it won't be what life looked like necessarily before we went into lockdown. But that is, again, sorry about the siren. I don't want to preempt what the health advice might be, because I think what stands New South Wales in good stead is, firstly, we work as a team across government, across various agencies, across a number of important areas. We take advice from key experts, and obviously we also rely on the health advice, and that allows us to make decisions moving forward. But what New South Wales has a track record of is not burdening our citizens unless we absolutely have to, and that's certainly our attitude moving forward. So we're looking at a scenario where we don't burden our citizens more than we have to, but we also have to accept the new world we're living in. This Delta strain is likely to be the dominant strain of the virus until we have further information, and we also appreciate that we need to vaccinate more of our population before we can live as freely as we would like. So in between now and vaccinating a greater proportion of our population, we need to think about what life looks like. But please know that we will move forward with confidence, with certainty, and appreciate the need to keep jobs and businesses going, as well as life as close to normal as possible. But that will all depend on the health advice, and I'm not really in a position to say anything more than that, because that is really dependent on the health advice, and there's not long to wait. So this time tomorrow, everybody will be very clear on what the government's intentions are beyond Friday.
Premier, I know we're an impatient lot in media, but we want answers now. But as much as you flag what's going to happen tomorrow, you must have a very good idea on what that's going to be. The past 4 days, we've had 35, 16, 35, 18. The fact that it's bouncing around and there's no uniformity of direction, you've already decided that on what course you're going to take. In terms of parents who need to provide childcare, working parents, etc., can you at least give an idea on the likelihood of schools returning, just the likelihood?
Please know that I can't give you any more information than what I am, because I don't want to say anything until I'm certain about what the health advice will be and what decisions we're making. But I also make this point. I think I said over the weekend that we anticipated numbers to bounce around. So we're actually seeing exactly what we thought would occur. The one thing that we're seeing, which we hoped we saw less of, is people being exposed in the community whilst they're infectious. Now, that is the one issue which our health experts will focus in on and give us advice, and that's why every day when Dr Chant and myself and the Minister and Deputy Commissioner Warboys say it's so important for all of us to stick to the rules and stick together, we literally mean that, because the Delta strain is far more contagious and reacts in a way that's different to other parts of the virus we've seen. And it's really in our citizens' best interest to allow us to make the decision as late as possible so that we're making the right decision moving forward.
I disagree with that. They would want at least some sort of heads up on what the likelihood would be, and you know the answer to that.
No, I think, with all due respect, I think parents want us to make the right decision, and I want to assure all parents, but also every single citizen, that every time we make a decision, it's in the best interests of our citizens. And I don't care how much personally or professionally my government or myself are criticised for the way in which we do things, but we do them because we want to keep our public safe and we want to provide that certainty, and that's why we'll be in a position to make those announcements tomorrow. And I know that parents will welcome, as well as every citizen. Yes, parents and children and the teaching communities obviously want to hear from us, but so do everyday workers, so do people who rely on a number of things going a particular way. So I appreciate the angst and stress. The one thing this virus has done, it's a great equaliser. All of us are in a situation where we feel a level of angst and stress. All of us have family circumstances and personal circumstances which we want answers for, and I appreciate all of that. Please know that. My government appreciates that. Dr Chant does. And that's why we always make decisions in the best interest of our citizens, and we'll be able to provide that certainty tomorrow so that we can move forward together.
Premier, 45,000 local government workers have been given special vaccination leave. Are you considering a similar thing for New South Wales Public Service?
Well, as I said, I'm extremely pleased with the way in which employers have been encouraging their workers not only to get tested when they need to and stay home, but also to get vaccinated when their turn comes up. It's in all of our interest to do that, and I've personally not had any examples. I've not had a single person or a single incident brought to my attention where someone's been denied the ability to get the vaccine, to get tested when they need to. And I just want to say a big thank you to everybody. We have been working together well. The vast majority of people have been doing the right thing. It's always the few exceptions that let the whole team down. It's always the case. If we think we're going to get perfection, we're not being real. no matter what situation we're in, perfection is an ideal that nobody can achieve. But we're doing pretty well in New South Wales in terms of the public doing the right thing, in terms of employers respecting employees, and vice versa. It's also employees respecting their employers. Don't turn up to work if you've got symptoms. You might have the virus and then infect your whole workplace, which doesn't help anybody. Then not only will you be out of work, but everybody else in your workplace will be as well. So these are so for us, we believe the settings we have in place at this point in time are the right ones when it comes to that issue. But obviously, moving forward, once the vaccine rollout starts, these are all issues that we'll look at.
Premier, have you got an update from Summit Care in regards to the vaccine rollout there? A number of staff still not vaccinated. Will you be asking for more jabs given the situation there?
We've been asking for more jabs for a long time, and we know that each state is given their allocation, and no matter how much I argue the case otherwise, it's not going to happen. But I will ask Dr Chant to comment on Summit Care if she has any additional information.
So just to let you know that an outreach team from Western Sydney Local Health District has been on site at the Summit Care facility from 8 a.m. this morning and is working closely with the facility to vaccinate those residents yet to receive a COVID vaccine. It was a small number, so again, it was pleasing to see that the residents' coverage was high, but there had been a number of people that had been admitted to the facility subsequent to the vaccination program that had been conducted much earlier in the year. So we continue to work very closely with that facility, and we'll do all we can to support residents. But I understand the distress to families at this time.
This would not be the only facility, aged care facility, where residents have moved in after the vaccination came through. So what's New South Wales Health doing, I guess, across the board for to make sure that all aged care centres that have had the vaccination offered have it offered again?
So certainly New South Wales Health has reached out to a number of aged care facilities in relation to aged care workers, and clearly we want to see high coverage in aged care workers as well. As you're aware, the Commonwealth had a vaccination program. What's useful now is that with the AZ vaccine becoming not in short supply, and most aged care residents would be over 60, then their access to the vaccine should be routinized. And I know that the Commonwealth is working very closely with GPs to ensure that GPs are incorporating a check when they're going into aged care facilities that all their residents are vaccinated. With a broader group of GPs having access to the AZ vaccine, then they can organise for that to be brought into the facility. And so hopefully this issue, which we'll need to continually address in terms of maintaining that high vaccination coverage in the elderly, those systems can be put in place.
The Premier said that we need to treat this as a new virus, live differently until we're all vaccinated. Will you be more cautious in what restrictions you recommend can be eased between now and October? And if we're being more cautious, what are some of the settings that you envisage will need to be in place until we are vaccinated?
So instead of answering that question, because as I said, we have to actually paint the picture. I think what we're clear, and the Premier has been reiterating this, is that we need to get about 80% of the population vaccinated. We need to do that as swiftly as we can. At the moment, the constraint is the supply. Once we achieve that, that will be another point of recalibrating our response. But with the Delta variant, it is more transmissible, so it is likely that we need to be particularly careful. And we do know the sort of settings. I think we've reiterated those. Although the Delta virus is more transmissible, the way it's transmitting is still the settings that we've known. So, for instance, it transmits well in hospitality settings, in your home. It transmits in workplaces, particularly where you have a large number of people, certain workplaces. So I think, although this is a more transmissible virus, I think the sort of settings that it transmitted in before, that we've seen COVID transmitted before, are mirrored, but they're just amplified. And what's additional is we've seen some settings where we would not have traditionally seen as risks. So, for instance, retail or other settings have now become a bit more our focus, and we will be collating all of the information that we've acquired to really hone in our own assessment of the settings and provide that advice to government.
retail? Is it time to stop retail stores that, wouldn't be deemed essential from opening?
I think the reality is in retail it's in specific settings. So we've known that we have got the additional protections of mask wearing. We know that people have to get food and groceries, heaters, blankets. I mean, these are part of essential for us to do. And I think if you've got a funeral, then obviously having flowers for that is essential. Ringing up and having an online florist, or ringing up and ordering a florist for someone to show care and compassion.
The reject shop, lingerie stores.
Look,
These are stores that are open, Dr. Chant.
I think the issue we have to understand is whilst we have seen transmission in retail, it's still a very much lower risk setting than the other settings. We will be looking at the data, and the epidemiology report will be up online later today, and we do describe the settings clearly in that report where transmission has occurred. But it is important that we make this lockdown, that people are able to go about and get essential products through lockdown. And throughout the previous lockdown, there's nothing different about this lockdown. We do require people to apply common sense. I think repeatedly I've said to minimise your activities, minimise your journeys, but that all we're asking for the community to do is be on the journey with us and apply common sense.
Can I just make a final point in relation to that? Is that the citizens of New South Wales should feel confident they have a government that will base its decisions on the best health advice, but also not provide unnecessary burdens. If all of us stick together and do the right thing, not only will we come through this, but we will show the way that it's possible to balance all the needs of our citizens without compromising safety. And excuse me, thank you. And I just want everybody, irrespective of how excitable some people might get, that we all have no reason to feel unnecessarily stressed or unnecessarily concerned about the future. Quite the contrary. Please know you have a government that first and foremost will keep you safe, but will also allow you to go about your daily business without too much stress. So please know that. So I don't want anyone to feel worried or concerned, but we're always very honest to say that the Delta strain is different, and so that is why we're in the situation we're in. But moving forward, people should look at our track record and know that we will move forward with confidence and in the best interest of our citizens. Thanks, everyone.
Dr Chant has been very thankful for the people of Waterloo that's turning themselves in, but should they actually also be fined for breaching the public health orders?
Well, first and foremost, health has a responsibility to extract's probably too strong a word, but to get the truth and to make sure people feel comfortable in telling us everything they've been up to. Because if people don't tell us everything they've been up to, it risks spreading the virus. And can I say this, Dr Chant and I were commenting on this morning, we see people go through various stages. If, first of all, they might be a bit cagey, and then they realise they need to tell us everything, and then they realise the guilt they feel, that they may have exposed people closest to them. I said this yesterday, do not underestimate the personal emotion and stress you go through when you intentionally do something wrong and the impact it has. And let that be a deterrent. It is a horrible experience to go through, to know that your actions have caused others to be in enormous grief and stress, and worse. We've seen very younger people hospitalised. I mean, Dr Chant didn't go through all the numbers, but there are younger and younger people needing to be hospitalised. It's very random. So just because you're young, don't think your friends or yourself are immune from having to be hospitalised. It is a random disease which affects people differently. Yes, we know which age groups are more vulnerable than others, but we also know that it's random. If you have an underlying issue you may not know about, or just randomly have a different response to the disease that others do, please know that can really impact you. And that's what all of us have to be aware of. And of course, first and foremost, our interest is getting the information, making sure that people are aware of their obligations. And we have a policy in New South Wales where health maintains the privacy of individuals. And in this context, I support that entirely, because it means we're able to keep our community safe where people come forward and tell us everything that they know. And sometimes people remember things subsequently. You might not remember everything in the first time you're interviewed, which is why health will keep going back. And that's why you might notice some exposure sites come up days after the exposure, because people have remembered or had a revelation which that they're sharing with health. So these are all issues that are part of our weaponry in fighting the virus. But I hope it also demonstrates how important it is for everybody to stick together and to do the right thing.
You said from the start of this lockdown that the measure of success was how many people were out in the community while infectious. We're Tuesday of second week and we're still seeing a number of people out in the community infectious. Does that show that we haven't really quite got a handle on the situation yet?
No, what it shows is quite the opposite. It shows that our contact tracers are able to get us information within 24 hours of an exposure. I mean, as I say to people, I've had the privilege of living day to day with what the contact tracers go through, and I've never seen them on top of their game, on top of what they need to do than I have in this strain. The speed with which they've been able to identify cases, it's literally been hours between interviews and exposure sites. I've never seen that rapid response like that. The only difference is this time round is the Delta strain is very different. So the cases increase exponentially. They don't just increase in raw numbers, but the rate of increase potentially can go through the roof, and we haven't seen that happen. So in essence, can I give an assurance to the community? I've never seen our contact tracers do as brilliantly as they have in the last couple of weeks. It has been a brilliant response, especially given where New South Wales could have been. But I do need to say up front, the main difference is the Delta strain, and we've also learned a lot from what we've observed in the last 10 days. So the first time we had the lockdown, we learned so much. We put in all the systems like QR codes and extra resources, which other states then followed. So whilst this has been a stressful time for all of us, it's been an amazing learning experience on what the virus is doing now, and we will take those learnings forward. And that's why I want to assure the community, please do not stress. There is no reason why anyone should feel concerned. Quite the contrary, please know that we have the privilege and luxury of having phenomenal health experts giving us the advice, but also in New South Wales, we will balance that advice with the needs of people to work, to live a normal life, until we get the vaccine. So I just wanted to reassure everybody, there's not long to go before we update the community on what next week looks like. But my most important message to everybody at home is please do not stress. Please remain confident that the government will do the right thing by the community, and we'll update everybody tomorrow.
Thanks, Commissioner. Deputy Commissioner, can I have you quickly? The Waterloo gathering. Yeah, do you have a figure on that?
At this moment, I think I gave a fairly good update this morning that it's probably in the vicinity. It's in the vicinity of 8 to 10 people attended the party, and I extend my appreciation for their cooperation. I think it's critical at this time that we work with the community to achieve compliance, and that relates to all of the public health measures. I'm actually very positive about the community response. The fact that when we're actually interviewing cases, that they actually haven't been out doing a lot of discretionary shopping. They've actually been, if you look at the exposure sites, I think you'll be really amazed to see that they're generally supermarkets, groceries, places that people are going for the key essentials for what they need to do. And I'm also pleased to see that people are wearing masks and following the health advice.
Further Ashley's question, Dr Chant. Further Ashley's question, Dr Chant.
For people to be in outdoor settings, because we haven't seen so far in this pandemic any transmission outdoors.
We do know that there was one case at the cafe where the person was actually sitting outdoors, but we know it's a very crowded place and we don't know if there was direct pass over because there was no CCTV footage. But I think what we've seen as characteristic of this pandemic is that COVID does not spread very easily outside, particularly if you can maintain that social distancing. And I think it is a really compact with the community. We've given them that information throughout. And we do know that if you need to get out of the house, it's much better to go and walk around, to enjoy the outdoor environments, to enjoy our winter, which for many parts of the world would be their summer. Enjoy that environment rather than being tempted to have visitors over to your home or do any other more risky activities.
Last question. Great, thank you very much. There are reports So there may have been other people at the Dragons party on the weekend. Are you looking into that? Potentially wives and girlfriends?
Yeah. New South Wales Police, on the information that they have finished their investigation. But quite clearly, if there's fresh information that is provided to us by any source, we'll make further inquiries into that. Quite clearly, police have shown that they will take swift action, and of course that would be the case. If we get fresh information, we'll reinvestigate and we'll take whatever action is necessary.
Have you taken action about Waterloo?
Yeah, we've always said that public health is important and it will be the priority. New South Wales Police, in terms of the Waterloo incident, have spoken to health, and when the time is right, New South Wales Police will make their own inquiries, but we're very mindful of the contact tracing, and what is the primary concern for us is to make sure that information is taken from those people, the relative warnings go out, and of course at the right time police will make further inquiries.
You saw a fairly volatile confrontation at Seven Hills yesterday where the people in that video were claiming to have a 12-year-old pepper sprayed. I'm told that it was actually a 20-year-old. Can you confirm that that is the case?
Yeah, that incident happened at Seven Hills last Friday. It was in fact a person that was 20 years old, went to the front counter of a store without wearing a mask. Police were alerted to that. They tried to speak with that person and get some details so that matter could be dealt with if you want. At that instance, that person refused to provide any details, refused to cooperate with police, and unfortunately what then happened, the person needed to be arrested. A number of people come around and it turned into what was a fairly unsavoury incident. But the message is really clear that police want to work with every single person over this lockdown period to make sure they comply with public health orders, but we need people to be reasonable. In that instance, there were 2 police that were also injured, and of course capsicum spray was used.
The irony here that it actually places police and the people in more peril, given the fact that close contact is a necessity.
Yeah, absolutely. Police are well versed in terms of their personal protection, but these sorts of incidents again put police at risk, and we will of course enforce the public health orders, but look after police at the same time.
Question on Zoe's law. One question on Zoe's law, Premier.